Welcome everybody. It is officially Live with Liz in December. I cannot believe we are in the final month of 2020. Many of us are excited to get to 2021. But I also want to make sure we talk candidly and openly today about the holiday season and sometimes what it might feel like, or the anxiety and distress that sometimes comes with the holidays. There's a lot of times of year or a lot of situations or events in our life that are from the outside supposed to be happy or joyful, and sometimes we don't always feel that way. And so I think it's really important that we just feel comfortable talking about that and that we're open and honest about the fact that that's okay. I love the slogan of "it's okay to not be okay." I think sometimes when people ask us how we're doing, we often just respond with what we think they actually really want to hear, which is "I'm doing well" or "things are going great," versus how we're feeling sometimes. And so I want to encourage you, if during this holiday season you're struggling, if OCD, anxiety, or other things have increased, reach out, seek support, seek help, because it's critical that you get the help that you need now so that you can function better in the future. As always, please post any live questions here on the right pane, say hello, let us know where you're from, and thank you for joining us. This is not a crisis hotline. If you are feeling unsafe or suicidal, please call the National Suicide Prevention Line if you live here in the U.S. or your local line wherever you might be internationally. Go call 911 or go to your local emergency room. Remember, the point of these webinars is for me to do my best to share some personal feedback and professional feedback, but it's not intended to replace therapy. And so we would encourage you to seek your own provider if you have specific therapeutic questions for you. Couple of amazing updates. So as many of you know, the International OCD Foundation did acquire the Peace of Mind Foundation back in October. During National OCD Week is when we announced it. You can now go to iocdf.org/peace of mind. This is where you can view the live stream schedule and submit topics for future questions. So many of you have asked what the merger will look like and what this will look like now that we're combined. And it's really the reason we decided to join forces is because we knew we'd be able to increase our impact beyond what we were already doing as an individual foundation, private foundation through Peace of Mind. And so we are slowly integrating into IOCDF, our YouTube channel, our webinars, our videos, and this community piece, right? The community outreach was really something that was super important and big to Peace of Mind and something that was really important for me to be a part of. And so we're so excited that now IOCDF has taken it on and that we have some direct avenues for you to get support there. I'm also so excited to announce, some of you who follow us on social media may have already seen this, but we are announcing the first ever IOCDF online OCD camp for kids and families. This is a virtual event specifically for young kiddos. It's for ages 4 to 10, and it's going to happen January 30th and the 31st. So the last 2 days in January, online, a virtual event for children ages 4 to 10. We often get asked questions about resources and support for kiddos in this range, so we have a specific set of programming and a specific event just for them. Registration is now open. You can visit iocdf.org/OCD camp. Hello, everybody. I see people from India, from Canada, from all over. Good to see you. Thank you so much. So what I'll always do is I'll jump into the questions that were submitted first, and then I will hop into live questions as they come. Again, my name is Liz Mackingall. I'm an advocate here at the International OCD Foundation. I'm also someone who suffered with OCD since 12, but a clinician in the field as well. I run the McLean OCD Institute here in Houston, Texas. So first question, how do I know that I found the right therapist for my child? This is an incredible question that we get all the time, right? People with OCD, people looking for someone with OCD, they really are struggling with, how do I know? How do I know somebody's the right provider? How do I know they're qualified? And so I always start with some simple questions that are easy for you to ask any provider when you're first searching to try to understand whether or not they understand OCD. And Nelson or others, I do want to say thank you for bringing this up. Any questions you post will be visible to others. If you have a question you'd like me to answer at the next Live with Liz, you can email it to us at info@peaceofmind.com, or you can go to the website we shared earlier, iocdf.org/peace of mind. There you can submit questions and topics, and you can just put anonymous so that it will stay that way. Anything you guys post in the chat will show up for others to see right now. So just a heads up for that. So anyway, so the question I get all the time is, well, how do I know? And it's really finding a therapist. It's really difficult, no doubt, but there's a couple really simple questions. So when you're first seeking out and you see somebody says they treat OCD, I want you to ask them what treatment they engage in. So when you treat OCD, what does treatment look like? What treatment do you use? And if they don't on their own say exposure with response prevention, also known as ERP, they probably are not an OCD specialist. And what I mean by that is that sometimes they'll say, oh, I do CBT, or, oh, I do exposure therapy. There's a specific treatment for OCD that we use that is the most evidence behind it, called ERP. Now, often clinicians will also use ACT. They'll also use other types of modalities, and there's no problem if they say that as well. But if they don't say ERP on their own, I would want you to kind of further assess to see if they have background and training in ERP, because that's really critical and important to being able to treat OCD. A lot of OCD clinicians are trained by OCD specialists or trained at OCD training centers. And so I would ask that too. If they're trained at a place like McLean or Rogers Neurobehavioral Institute, or under certain clinicians like Dr. Bramowitz, Dr. Grayson, others, right? You know that they have backing and training in somebody who really understands OCD. And so those are all important questions. Now, the second piece is, what about once they get to therapy? So once they get to a therapist and they're actively engaging in therapy, how do I know if it's the right one? How do we know? And my response is usually how they are, how the relationship is with the individual. So is the individual starting to form a bond and a relationship with them that will allow them to be able to be open and engage in this really hard work, which is OCD treatment? And then my second is, are you starting to see progress, right? We don't expect progress to happen on session 1 or 2. And sometimes, in fact, things can get a little bit worse before they get better, because we're starting to take away previous negative coping mechanisms, previous reassurance seeking or rituals. But overall, in 6 to 8 sessions, is it starting to click, right? Are you starting to see progress? Is your child starting to see progress? And then, of course, I think it's really critical that the therapist should also be including family members. If it's a young child, that's really important, because we want to work together as a team. So I think whether or not, how to find the therapist, make sure they do ERP. Once you get there and you're talking about behavioral therapy, start to look for progress. And I would say about by 6 to 8 sessions, roughly, that's a guess. Don't hold me to that. But, typically 12 to 16, you should see a lot of progress. And so in 6 to 8, you'd want to see some movement for sure. When seeking treatment for my child with OCD, where do I start and what's the first step? So we just talked a little bit about that. So first step could be to visit iocdf.org. There's a Find Help tab where you can put your zip code and providers will be listed. And then I recommend that you call and ask those questions I just talked about. So what type of treatment do you do? And listen for if they do ERP. Also consider, is there an OCD specialty center near you? If there is, so a clinic like McLean OCD Institute in Houston that we're at, or McLean OCD Institute in Boston, or Rogers Memorial, places where they specialize in treating OCD and they have specialized training, right? They're going to have more background than somebody who went to college and does private practice but has never worked at a specialty OCD program. So if that's available, or somebody who's been trained in one, that's a great place to start as well. What can I expect from virtual treatment and teletherapy programs? So I can't really speak to the research and the efficacy on it 100% for OCD, but what I can tell you is that what I've seen is that it works, and it works really well. For myself, I personally have transitioned, obviously, during COVID to both doing teletherapy with my clients, but also engaging in teletherapy with my clinician. And it is absolutely phenomenal, right? I'm still working with my therapist. I'm working with them in real time. And sometimes the benefit is that I get to do some of my work in the environment that it's most triggering. So in my home, wherever it might be, that I can do it as long as it's in a safe and confidential space. And so teletherapy, while it's different, I think it's here to stay, not just until COVID subsides, but even for the future. And it's very effective. Many of us who treat OCD, we're actually doing teletherapy on different levels, maybe not exclusively like we often are now for outpatients during this time, but we were already doing it prior. And so I do think that it's really important to note that for few of us is this our first experience, and it's our job to help make teletherapy as effective as possible. The next question is, I have a daughter who suffers with BDD but refuses to see a doctor or a therapist. Any suggestions on how to get her to go to treatment? She's 28. So I would actually encourage that you reach out to somebody like Chris Tronson, who's an advocate for IOCDF, who really focuses on BDD, because it's not, just candidly, it's not something I've personally dealt with, or my professional background isn't in that specifically. However, when it comes to motivation, I think it's really tough. When someone's 28 years old and we're an adult, right, we get to choose whether we want to do treatment or not. And actually somebody forcing us may not be that useful anyways, because we need to want to be there. We need to want to believe in treatment or to believe that we need to go to treatment. I think what's critical is that you help introduce them to a provider who can appropriately help them, and see if there's ways you can encourage or support them without forcing them to consider treatment. I often say start with education, not with the therapist, because dragging someone to a therapist isn't going to be as effective, versus what if you connect them with Chris Tronson's videos? What if you have them watch some content or read on BDD through the IOCDF community and have them understand that treatment exists and that with appropriate care, they can get relief and they can learn to manage their symptoms? Because I think oftentimes we resist treatment because we don't believe in it. We don't think it can work for us, or we don't think, like, we don't understand what's going on and that we can feel relief from these symptoms that we're experiencing. So I say start with education and slowly support them in helping them find a provider as they want. So really make sure they know that I don't want to see you struggle. I love you, I care about you, and I want to support you, but I want to do that in a way that's meaningful for you. And if and when you're ready to consider treatment, I would love to help in any way that I can and support you in any way that I can in that process. In the meantime, I've seen some incredible videos and I'm going to share them with you. You can watch them if you want, you don't have to, but I think they were really informative for me, so you might get something out of them as well. And send them, right? We don't pester, we don't bother. We're not going to say every day, did you watch that? What do you think? What do you see? But instead allow individuals on their own to explore at the level they're comfortable with. All right, so let's hop into live questions. Can you give examples of what it looks like to lean into your most taboo and distressing thoughts like POCD? Great question. And so first I want to say, I really want you guys to be doing ERP and exposures with a licensed clinician who specializes in OCD. I think it's really important that you work together to kind of build your treatment plan so that you understand for yourself, because it's individualized, what should I be doing and what will it look like? Really, the basis of ERP, the basis of OCD treatment, when we've been diagnosed with OCD and we have a clear subtype, whatever it might be, POCD, harm OCD, you name it, it's about uncertainty. And so it's about living everyday life that often we're avoiding, or if we engage in everyday activities, going on a walk, whatever it might be, we're ritualizing, ruminating, reassurance seeking, confessing after. It's about removing rituals, still choosing to live our everyday life, which would include potential exposures throughout the day, and leaning into uncertainty. So it's not just about not ritualizing. It's not just about doing, living life and then ritualizing later. It's about living life, not ritualizing, and leaning into uncertainty, accepting that things may or may not, maybe not statements. And this overall uncertainty is a concept that we have to accept around our fears versus trying to be certain, right? We know most of where OCD attacks is we want to make sure, we want to solve, we want to know that we're a good person, that we wouldn't do something wrong, that something bad isn't going to happen. And really the treatment, it's just about leaning in that, like, hey, it may or may not, and I'm still going to choose to live my life with this sound, this noise of uncertainty, and while taking that risk. Hello, my friends. So good to see you. Dublin, Ireland. We have people from all over. Texas. Hi, Thomas. North Carolina. You name it. Yes, Catherine, I agree. I'm so happy Just Ethan and so many resources exist, but I agree. I wish they existed earlier, but I do think we're finally starting to make a dent in resources and support that needs to be available and has needed to be for a really long time for this community. So happy to hear for some of you that Rogers or treatment has saved or changed your life and that you are able to manage your symptoms now. It is just so critical. And I agree. Understanding the importance of ERP is profound, right? And it's something that we have to do constantly all the time, but it can be quick and easy. I call it ERP on the go, right? Sometimes it's 10 seconds where I lean into uncertainty versus ritualizing, but that's the difference in whether that thought is going to continue to bother me and be triggering and something I want to solve throughout the day, or whether I can move on and lean in. Favorite books and workbooks, not necessarily therapeutic, but memoirs. So my favorite therapeutic book is Freedom from OCD by John Grayson. Memoirs, someone down a little bit later mentioned Kissing Doorknobs. I do love that book. It's been a long time since I've read it, but it was a book that I read as a teenager. So I would have to reread it to see where I stand now on recommending it. I know Jeff Bell has a book on OCD. I know that so many different people have written memoirs and have started to publish their books, from Shala Nicely, Jeff Bell. There's a couple, Zach Westerbeck just published a book. So lots of different ones. And really it's going to be what fits for you. But treatment-wise, OCD Workbook and Freedom from OCD, I would certainly recommend. I agree. Seeing other people really reminds us that for me, it ignites this kind of reinvigorating, inspiring need to help other people and to push through my OCD so I can offer support to others who might need it as well. So yes, you can absolutely find online support groups, Leanne. So IOCDF should have some resources for online support groups. Health Unlocked is also a wonderful platform, and lots of different local organizations do engage in support groups in your area that you can oftentimes connect with. Hi, Kate. So good to see you. Amanda, I'm so sorry to hear that you're having a bit of a lapse. Recommend ERP 100%. If you've never had it, that means that it could be extremely useful and beneficial, and I certainly recommend it. So specialized OCD treatment, right? For any medical condition, we want specialized care. We wouldn't go to a general practitioner. It's critical we do the same for OCD. Holidays are coming up. It's mid-December. My sister's birthday's this weekend. My mom's the next. Christmas will be here. New Year's will be here before we know it. And sometimes that means increased anxiety and stress. Whether it's contamination OCD, we're going to be around people. Whether this year we can't be around people because of COVID and we're isolating. Remember to take care of yourself. It's okay during the holidays to not feel jolly. It's okay during the holidays to be struggling. Reach out for support. Reach out for help. My reminder to you all is that treatment works. Treatment's not easy. Treatment's hard. But we can learn to live a life worth living despite having OCD. And with appropriate treatment, our OCD can be at a place where it doesn't make decisions for us. We get to make decisions for the life we want. Remember, help and hope are always available. I love you all. Happy holidays. And I can't wait to see you guys in a couple weeks for our last Live with Liz of 2020. I'll answer the last question. Sorry. How do you feel about working on underlying issues for OCD, like control issues and insecurities, using approaches other than ERP before going on? Please, 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 you guys watch the webinar that I did with Dr. Grayson through IOCDF last Wednesday, because I thought it was so great that he spent so much time talking about the critical importance of learning the concepts of uncertainty before we dive into ERP. So I think if there's underlying issues that trigger our OCD, whether it's around insecurities, control, whether it's around not really wanting to lean into uncertainty or not being willing to lean into uncertainty, those are all things that I would say 100% we have to work on and address simultaneously or before we do ERP. Because when we do ERP, we have to be doing it with intention, right? Because there's a core reason we're doing it, right? We want to live a life that OCD doesn't control. We want to live a life that anxiety doesn't control, which means that we're willing to live a life of uncertainty. If we're not willing to live a life of uncertainty, then we're not going to be able to engage in ERP appropriately, or we are, but it'll be like playing whack-a-mole. We'll be doing ERP all day long after one another because it's like, okay, we put out this fire, we put out that fire, we put out that fire, we're just bombarded with intrusive thoughts. But overall, if we choose to lean into uncertainty and choose that lifestyle, we're able to address many of our OCD fears at once versus necessarily having to do all of them all the time as they pop up. When OCD and trauma go hand in hand, there was a wonderful webinar that I did with Chad a couple months ago that you should be able to find on that same website that we talked about earlier, that's about comorbid OCD and PTSD and how to address it. I certainly recommend that you watch that. Please submit your questions. You can send them to info@peaceofmind.com, ask them to be anonymous, and we'll be happy to address them in the future. Thank you guys so much. Happy holidays. Can't wait to see you in a couple weeks. As always, help and hope are always available.